Start.
Yeah. Good evening, all. This is Dietitian Flora from Oasis Fertility. So today I'm back with another topic, like what are the important nutrients, why nutrients is important, and why nutrients are beneficial in the treatment, and what are the nutrients which can mix and which can be helpful to decrease the risk of the miscarriages. Right. So here I'm going to tell you about what are the important nutrients and from where do we get those nutrients from the food. Okay, so there's six nutrients that can be helpful in decreasing your risk of your miscarriages. Like why all these nutrients are important and when you have to be included and for what purpose it is required. So this is gonna I'm gonna talk about today. So here these are the six nutrients like vitamin D, folic acid, vitamin B6, B12, vitamin E, and zinc. These are very top nutrients where you have to include it like in a every day, right? To not taking it like 1 day or 2 day. Like these are the supplements also can be included by the your doctor where the as these nutrients can be added in the tablet form, the supplement form, where you have to include by the food as well. Okay, many of my patients will be asking like, ma'am, I do have my supplements, I'm every day taking my vitamin D dosage and I am including my folic acid tablet as well. Is it necessary to include all these nutrients? Yes. We might get enough nutrients from the foods what are you eating. So these are the nutrients which play a very important role when you are in the treatment where it has been very beneficial to your body. Like would be like increasing the quality, improving the quality wise, the quantity wise, and increasing the blood flow to your reproductive system, maintaining the DNA, and also improving your iron levels, and also giving good signals to your reproductive system. These nutrients play a very important role when you are there for the treatment and when you are been planning for the treatment as well. So these are the must where we be adding in the diet. Usually if we start up the treatment, any kind of treatment you are planning from, like the fertility based treatments, or when you're planning for the pregnancy, from the prior itself, these are the supplements being added by the your doctor as well. So these are the foods to be included prior to decrease the risk of the miscarriages, which will be really supportive to your reproductive system. So this is how, like, from where do we get all these? Your question is right. So usually it we get from the foods like vitamin D again and the folic acid. This is how folate is something which you get from the foods. I mean, and folic acid we get from the supplement. So or usually there is a difference between the folic acid and the folate. The folate found from the food what are you eating. So usually you get the folate from the dark leafy vegetables, the avocados, the green colored, all the green vegetables. You have to include it in the form of smoothie, and then in the form of dal form, and then in the form of juices, and then in the form of soups. If recipe is yours, but you need to include it like every day, not taking 1 day or weekly once, right? That doesn't gives you the what exact value is required for the treatment. Okay, that is not enough. Like weekly once, if you have been taking it, that the number which we want, the nutrient value what we want, it is not sufficient when you're planning for the pregnancy. In the fertility treatment, if you are looking for to increase the folate rich diet, you need to have it like in an everyday process, like not 1 day or 2 day. Okay, do not skip it. Try, you have n number of green leafy vegetables, different variety of vegetables we have. So green leafy vegetables, so you can add different vegetables, different greens have different vitamins and minerals we have in that. So try to add a different varieties of a colorful plate. You have to include it. Always we do suggest like having a colorful plate. So try to include different varieties, not only sticking to the spinach. So do not only stick to the only methi. So do not, you have to just change the variety of foods where you get n number of vitamins and minerals and good amount of folate from the different green leafy vegetables. Try to include differently in a daily purpose where it can be improve your folate vitamin. So these are all other sources would be the beans, nuts, oranges, and banana, where you can easily grab it every day. Easy to carry to your office and easy to place it on your table. So these are something which will be handy. So try to include it, which will be really helpful to improve your folate rich foods. So this is how very beneficial and the defects of the neural and the DNA will be like process will be good. So other way is like zinc nutrient is like zinc is always which will strengthen up and which will improve the blood flow as well. And we do get zinc mineral from the whole grains, dairy products, red meat, chickpeas, and the almonds. So if you are a vegetarian, you can include the other vegan foods would be the dairy products, and the wholesome pulses would be you can include either in the form of dairy products in the form of milk, buttermilk, and cheese, or else paneer. All these you can include it. And the other form of pulses would be either in the form of dal again, and also in the form of any kind of dosas or any kind of stuffing based chutneys also can be included. So this is how the nutrients can be beneficial. So try to include different varieties of foods which are very superficially it is getting over there. So you have to include it. Different nutrients are very beneficial. So number three is again vitamin D, which is very useful, which gives a signal from your brain to your reproductive system, which always be the we when the patient comes we do add a good supplement of the vitamin D as well. But natural source of the vitamin D is like sunlight. So always expose your body to the sunlight. Start getting up early in the morning, expose your body. Either taking a good breath of walking can be helpful to improve your vitamin D as well. And always vitamin D and calcium both together plays an important role in the absorption. So try to include one glass of milk or a buttermilk or any kind of calcium rich foods absorb good for a better absorption. So vitamin D again gets if you are not able to have a milk products, and you usually vitamin D is also found in the salmon, egg yolks would be, and mushrooms, and as I told you the sunlight. So these also can be included. Either if you want to have the salmon, the fish, you can include it like weekly twice, not been overcooked, not been deep fried. Always use steamed or grilled or shallow fried as always. Yes, keeping longer time for the overheating can the white minerals can be disappeared. So always cooked in a very low flame and also with a very minimal heat, so that the nutrients whatever your food are you eating, it should be beneficial to the body, so that the nutrients go and store it, then it gives you a result. So this is how the vitamin D plays an important role again. So these are the sources of the foods where you can include it in every day. And the other slide comes from the omega-3 fatty acid, the good fats, which again improves the quality of the sperm would be, improves the quality of the egg. So these are the again the superfoods which will also gives a blood flow to your reproductive system. So these are the sources of the foods which are found in the like chia seeds, the flax seeds, the salmon, the walnut, and the tuna. So this is how, again, these are like chia seeds can be used in the form of, or that you can add. Usually, I do suggest all my patients to add, like, soak it overnight. When the jelly gets formed, just add 1 spoon of the chia seeds. You can add it in the 1 glass of a lemon juice, or 1 glass of a buttermilk, or you can add it in the puddings overnight, soaked oats in the form of puddings, oats with the berries, nuts, all these with like a recipe would be yours, taste would be yours, but try to add it, because every day if you're taking whole, I mean the dry chia seeds or the dry walnuts, you have be sometimes you feel bored of it, right? You don't feel like to eat all those. So try to change the recipe, adding up, making into a form of I mean the custard in the form of freshly baked, no flour, I mean no maida based cakes would be, the muffins would be. So there are n number of recipes to be add upon. So try to take time for yourself, prepare for yourself, but you need to initiate, like, what good food is important when you are planning for the treatment, right? So if you want to do not take the risk of the miscarriages, you need to include all the varieties of foods, adding into a different varieties of the different foods, adding up all these the vitamins play a very important role in the when you are there for the treatment as well. So this the next slide come from the vitamin E and the vitamin C. So these are the two vitamins where usually E comes from the nuts and seeds. So these are again handy. Either you can dry roast it by adding, if you are salty or you are a spicy person, you can add some dry roast them, adding up a salt, pepper, and the salt, sprinkle on them. You just put it on your container, a small airtight container, and you can store in your bag, right? These are very handful. Instead of choosing any kind of a junk food, but you can choose your healthy food. I mean, you can choose your healthy snack. So these very important role when you are planning for the treatment, right? So this is how you, and why these plays a very important role, which are be beneficial to you, which can be beneficial for your reproductive system, and which can be beneficial for the tomorrow's for your tomorrow's baby, right? So these make your reproductive system where it strengthens up, and which gives a good amount of the quality, and which gives a good flow to your reproductive system as well. So you need to choose always good amount of vitamin rich foods, which will play a very very important role, and you can be not into the risk of the miscarriages, right? So you need to know, like, these are the important vitamins, and vitamin C is always which improves your immunity again, which can fight amongst infections again back there. So all the berries, antioxidant rich foods again plays a very important role, which will removes all the toxins as well. So these which increases again the quality among them, which fights against from the germs and the infections. So these are the superfoods like kiwis, berries, all kinds of berries. If you're not getting fresh berries, you, even if you're getting a dry berries, just soak it first overnight, just remove, which can remove the artificial sugars which has been coated on that. You can add those in the smoothies, either you can add up early in the morning whenever eating up. So varieties of mixing of all the nuts and seeds can improve your vitamin C, can improve your vitamin E, can improve your other plays of antioxidants. So these are important when you are planning for the treatment. So these are the vitamin 6 nutrients included like every day. This is how, which plays and which are very important in the everyday day-to-day lives. So these are the nutrients which has to be included like every day, at least for 2 months or 3 months. If you are taking for a 1 month, you might get result, but you cannot expect the result immediately. There it is something where you get a very minute value from that, nutrients from that. That is how we do suggest you to, I mean, I do suggest all my patients to have at least for 3 months, where it takes time to give you a result. So do not expect any instant result, right? So for you, if you are eating apple in the morning, if you want something, a good result in the evening, this is wrong way of thinking. So this is something where you have to include like 2 months, 3 months, which has to go in, store in your body, and you can see some changes in your body right from the third month, like improving the quality, changes on your skin would be, changes on your hair, right, different changes would be you can see among yourself. So including different varieties of usually we do advise Mediterranean diet, so it is a combination of a balanced diet, adding up for different food groups every day, filling up your plate with the fruits and vegetables, a colored plate. This is how we call. So colorful food, what we have to include it. So this is how you need to include it every day. So here the slide tells that taking a wrong type or a wrong dosage of medicine. Okay, so usually patients will be asking, I'm taking all these supplements. Is it necessary? Is it right supplement for me? Is it vitamin C supplement is important to me? Is it folic acid is important? Yes. These are very, very beneficial when you are planning, and also can be can you can get rid of the miscarriages. The risk you can get rid of the risk of the miscarriages as well. So these are very important. The supplements as well as the food both together plays a very important role, which can you might sometimes miss your supplements, but the food, whatever you're eating, can give you those nutrients. So try to add up together so that you might get some more nutrients from the food and the supplements, whatever you're taking it. So this is how. And the diet quality is sorted. Following a healthy diet, yes, it can be improved by a healthy diet, but also you need to correct your lifestyle. You need to change your lifestyle. How is your lifestyle? Also, is it you are being having a good physical activity? Are you being stressed out? Are you being hydrated well? These every plays important role. Not only the diet. The timing matters. What kind of a food are you taking? Are you choosing? Usually what happens is, usually patients sometimes they skip the breakfast, and they do all the fat diets would be the keto diet, intermittent fasting, all these. Okay, fine, I accept when you are looking for the weight loss. But when you are in the treatment, when you are looking, when you're planning for your pregnancy, but you need to focus on the good nutritious food, like adding up every day. Okay, so this is how. And the next slide tells us like not having effective just of the placing of your stress of the management, and placing the unnecessary restriction on your diet, having a few too many of the, see, this is how many of my patients will be asking like, how are being stressed out, are you restricting on your diet? See, many of the patients do come by with the obesity would be, or no, overweight would be. So we have to reduce the calories, we have to reduce the carbs, but we have to reduce the fat. But we have to include the complex carbs instead of the simple carbs. How many kilocalories are you eating? Are you been eating with the too much of oily or too much of sugary foods, which gives you more of the calories? So this is how you need to plan. you need to focus on the good diet by adding up what we call as Mediterranean diet, by adding a good food, what we call. So this is how you need to focus on the good diet, good amount of nutrients dense diet. So these will be very beneficial, and this will be important role when you are there in the treatment, and it can rid of your miscarriages, right? So please do follow these important nutrients. Try to include it, like adding up different varieties of the nutrients, like adding up like vitamin C, vitamin D, folate rich foods, and also folic acid. Zinc plays important role. See, these nutrients come from the food water you're eating. Choosing up every day by adding a balanced food and a Mediterranean diet will always helpful in the treatment as well. So these are the slides where I've been talking about. So if you have any queries related to the diet, if you're not able to know it, what what food have been lacking you are, what varieties of foods you need to include it, is the weight loss diet, is the weight loss is necessary in the treatment, or can you able to do, or you can able to do the other kind of any fat diets when you are there in the treatment. So here I'm a dietitian, will be always be helpful for you. So there's have been a number under, you can get back to us over there to us. If you have any queries, you can get back to us. So I think we have a query: what reduce risk of miscarriages? Here I have got a good query over there. What reduces? So the food, you need to check for the food. What are you eating it? So I've been talking about like different minerals on the different nutrients you need to include it like every day, called as a balanced food or a Mediterranean diet you need to focus on. And also you need to maintain your timings, and also you need to focus on the physical activity, either walk or yoga. Okay, and there should be no stress, and hydrating well can reduce the miscarriages. And also you need to be, it should be sustainable for the longer time. Whatever you're doing it is like you need to focus it like on it every day. So these are the points where you have to do it like every day, which can reduce the risk of the miscarriages. Can I have a next query? How can I prevent miscarriage in progress? So you can prevent the miscarriage in progress like doing it like every day. You need to focus on it every day, so that you can prevent the miscarriage in the progress. You need to set your mind first. Setting up mind is very, very important to prevent the miscarriages in progress. Can I have a next query? I think we have done with the session. Thank you all for the joining up here. I'll be back with another topic. Thank you.